that question comes up, then, you've got to have a bit of a word with yourself. Okay. We're gonna change flavors, and we're gonna get onto blood vessels. Now, the main focus for me on blood vessels, folks, and please use your notes, is I want to look at structure and I want to look at function. That's what we want to do with blood vessels. Now, I'm going to throw these in pretty quickly, and the first thing I'm going to do with structure and function is I'm going to talk about our arteries. So let me get my arteries. I'm simply going to name it A for artery over here. So what is the structure of these arteries, first of all? Well, first of all, we have thick muscle. That is a structure. In fact, you can see that muscle wall just here, that thick muscle wall which is there. We also have a smaller lumen. Okay, now can I be clear what this is smaller than? This lumen, which of course is the opening to the cell itself, let me get rid of that because it'll help us. That is smaller than this. Look at this cross section here, look at this cross section here. The artery is smaller than the vein, so we've got slightly smaller lumen. And finally, we have elastic walls. Now, there are elastic walls, which we'll come to in a second, because these types of vessels, they deal with high pressure blood. It's very proximal to the heart. So when the heart is in contractile systole phase, then of course they're applying much force to the walls of the artery, and the arteries have got to be able to resist that. So they're nice and elastic. Now, they also, of course, have functions, these arteries. So what are they? First of all, they carry oxygenated blood. Now, you probably be able to tell me there's an exception to that, which of course is the pulmonary artery, but all but the pulmonary carry oxygenated blood. Secondly, they can cope with high pressure blood, and that's because they're leaving the heart, right? That's what they do. So their function is to cope with high pressure blood. And the other one, which I'd really suggest to you is an important one, is they're capable of vasoconstricting and dilating. So this muscle can contract in on itself and make that lumen smaller, and of course it can dilate out on itself, and therefore it can make it larger. So we've got this notion of vasoconstriction and dilation. Now, the second one we're going to have a look at here is our veins. So let me just put sort of pink for veins here. Our example, of course, is just here, my V. So what are our structure? This time we've got a thinner muscle wall. Let me put thinner muscle. Okay, so they do have a muscular wall. And by the way, this little muscular wall here is important because veins can actually pulse. They can actually boop, 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 a bit like a, well, I was going to say it's a bit like a heart. It's a ridiculous statement, it isn't at all. But they're capable of actually just pulsing. Now, if you think about what a point we're going to come to in a second is dealing with low pressure blood, this is really important because it can start squeezing that blood back to the heart a little bit more. So the muscle is required, it's just not as elastic and thick and robust as in the arteries. Secondly, we've already touched on this, we have a large lumen. Now notice, that's an E in there, believe it or not, let me add an E, the large lumen. So this is kind of spacious, okay, but of course that pulsing can change that. And we also have in here what are called pocket valves, more of which a bit later on, but effectively pocket valves prevent blood flowing in the wrong direction and travelling back from whence that blood came. We don't want that. So what are the functions? Well, I've mentioned some already. In the main, with the exception of the pulmonary vein, I'm not going to go over that, but check your understanding. They carry deoxygenated blood. They deal with low pressure blood. And folks, importantly, these veins, they're capable of preventing backflow. Okay, so that's their job. And of course, we're sort of skimming over. The main thing is to return blood back to the heart. Now let's finish this off. I'll do it in a sort of a blue colour archipelary. Now, can I stretch at this point? We are not to scale here, so I'll just put my C. It was meant to be blue. We are not to scale here. This thing, you guys should know exactly how big this is. If you don't know that it's 7 micrometers in diameter, because that's the exact scale of a red blood cell, then you should be talking seriously to your biology teacher, because you guys obviously have studied that. Now, this is what we're going to say. The structure of this, it is 1 cell thick. More about gaseous exchange in a few moments time. So it's 1 cell thick. Secondly, it surrounds tissues. So its structure is to be at tissues, okay? So whether that's a muscle tissue, alveolar tissue, it surrounds tissues. They're found between A's and V's. In other words, they connect arteries and veins. Hey, that's a neat little point, right? And the second one, I'll just put it over here, they're very numerous. Okay, now there are other structures about them. For example, one we tend not to get a mark for in PE, but you guys know really, really well, is they're partially permeable. I mean, really feel free to write that in your answers. Absolutely accurate. Also, there's a little bit of muscle on the entryway to these capillaries, but maybe that doesn't get as clear a mark as some of the points, but we'll come back to that perhaps elsewhere. Second, so function of these things, we get efficient, and I really encourage you to include that word, gas exchange. Now, again, you can talk about diffusion and permeability here. That's absolutely fine. But the other thing that these ones do is they remove waste products. I mean, not actively. It happens via them, I suppose, is what you would say. And of course, that's in that gas exchange down the diffusion gradient type concept. Sip my tea there. Just bear with me a second. All right, questions. Notice the wording. State 2 structural features. So 2 things I want to get here. The first one is I'm asked specifically for 2 things. Now that means your exam board is able to say, mark the first 2 answers only. Okay, so that is possible. They'll say that. Second one, we're only going to get marks here for structural. So what do we say about capillaries? They've got a small lumen. They're tiny. They're really, really small. And they're 1 cell thick. Okay, so the diameter of a red blood cell, and they're 1 cell thick. Notice we could have got between the arteries. And this is a nice point. I didn't actually put this over here. We've also got a large surface area. Okay, large surface area. So all those points nice and relevant. Now, if we go a little bit further here, we've got now 2 functional features. Now, again, this is of capillaries. It could have been in veins. It could have been in arteries. Site of gaseous exchange, lovely. And we've got, there are millions of individual capillaries. Okay, so therefore we've got this sort of very large surface area, for diffusion. All right, so that point there would also be completely legitimate in that particular case. Okay, so we pick up those 2. But the 2 points I want to make is be prepared to answer specifically 2 or a minimum of 2, and also look for the word structural or functional. That's likely to be in your questions. Now, I'm just going to take the briefest of stops there just to